Welcome to Rwanda Medical Academy. Today's lesson is about Principles of Management in Toxicology.
Introduction. Toxicology, the study of the adverse effects of chemicals on living organisms, is a crucial field in both environmental and medical sciences. When it comes to the management of toxic exposures, whether they're accidental or intentional, the RESS approach provides a structured method for treatment. This approach, RESS, stands for Reduce Absorption, Enhance Elimination, Specific Antidote, and Supportive Treatment. Let's dive deeper into each of these principles to understand how they are applied in a toxicological emergency.
R stands for Reduce Absorption. Reducing the absorption of a toxin is the first critical step in managing a toxic exposure. The goal here is to prevent or minimize the toxin from entering the bloodstream, where it can then be distributed throughout the body. Strategies depend on the route of exposure and may include 1. Skin decontamination. Washing the skin thoroughly with soap and water to remove substances that have come into contact with it. 2. Gastrointestinal decontamination. This can involve induced vomiting, though it's now less frequently recommended. 3. More commonly, activated charcoal is used to bind toxins in the stomach and intestines, preventing their absorption. Now let's jump on E, which stands for Enhance Elimination. Once a toxin is absorbed, the next goal is to enhance its elimination from the body. This can be achieved through several strategies, depending on the nature of the toxin and how it is metabolized and excreted. Methods include 1. Diuresis, increasing urine production to flush out toxins more quickly, sometimes with the aid of medications. 2. Hemodialysis, a procedure where blood is filtered outside the body to remove toxins, particularly useful for substances that are not easily eliminated by the kidneys. Coming to S in RESS approach, it stands for Specific Antidote. Certain toxins have specific antidotes that can neutralize their effects. Administering the right antidote promptly can be life-saving. Here are a few examples. 1. Naloxone, an antidote for opioid overdose that rapidly reverses the effects of opioids. 2. Atropine, used in cases of poisoning by certain pesticides, organophosphates, and chemical weapons, nerve agents. The last S in RESS approach stands for Supportive Treatment. Supportive treatment encompasses a wide range of medical interventions aimed at maintaining vital functions and treating symptoms until the toxin has been eliminated from the body. This can include 1. Fluids, to prevent dehydration and assist in toxin elimination. 2. Oxygen therapy, to ensure adequate oxygenation in case of respiratory distress. 3. Temperature regulation, to manage hyperthermia or hypothermia which can result from toxin exposure. Additional management principles. While the RESS approach provides a robust framework, incorporating additional principles can further enhance toxicology management. 1. Prevention and education. Preventing exposure to toxic substances is the most effective management strategy. This involves educating the public about potential hazards, safe handling and storage of chemicals, and the importance of using personal protective equipment when necessary. 2. Risk assessment and mitigation. Understanding the risks associated with different toxic substances and taking steps to mitigate these risks is crucial. This includes safety measures in industrial settings, regulations on the use and disposal of hazardous materials, and public health initiatives. 3. Research and development. Continued research into the effects of toxic substances and the development of new treatments and decontamination techniques is vital. Keeping abreast of scientific advancements ensures that management strategies evolve and improve over time. 4. Collaboration and communication. Effective toxicology management requires collaboration among multiple stakeholders, including healthcare providers, public health officials, and environmental agencies. Clear communication is essential for coordinating response efforts and disseminating information to the public. Conclusion. The RESS approach to managing toxicological emergencies provides a structured framework that helps healthcare providers rapidly assess and treat patients who have been exposed to toxins. By understanding and applying the principles of reduce absorption, enhance elimination, specific antidote, and supportive treatment, healthcare professionals can improve outcomes for patients facing toxic exposures. Remember,
In any case of suspected poisoning, it's crucial to seek professional medical assistance immediately, as specific treatments and interventions can vary based on the substance involved and the condition of the patient. Thank you for learning. Join and save a life with us at Rwanda Medical Academy.